Health Innovation Global Forum 2024, Milan, Auditorium Human Technopole, Mind, Milano Innovation District, a day to talk about the future of healthcare, its innovation, and what's next. In this moment, we are together with Angela Kukula, who is a CEO at MedCity London. Thank you for being with us.
Thank you.
So, Angela, with you today, we want to talk about the access of data. So, what is the actual situation, we can say, in the Europe zone for companies to access to access the data, and what are the opportunity and the challenges? But we want to start from the state of the art of the situation at the moment.
Sure. So I'm not sure I can talk about the rest of Europe, but I can talk about accessing NHS data. So for those that don't know, the NHS is the healthcare system in England and in the rest of the UK. It's one of the few healthcare systems in the world that is completely has what they call universal access, so everyone can access. It's available to all UK citizens, and it works right from birth right through to either death or leaving the country. So it's really a very rich data set that includes it's a very large data set. It has potentially up to 100 million people. It has it's very deep. It includes lots of tests and records. It's longitudinal. It follows a patient through time, and it includes rare data and diverse data sets and diverse populations. So actually it's very it could be very valuable to companies. And when we talk to companies, they want to access the data. They want to access that kind of data, those rare data sets, the diverse data sets, something that's very deep and very complete.
So, but what are the challenges and opportunities at the moment, as we said before, to access the data for companies like yours, for example, and also from your point of view?
Sure. So the opportunities are huge. So the data could be accessed for research to allow improvements to the health system, to allow companies to develop new products, to improve the efficiency of the health system, to improve patient outcomes, to address inequalities where different populations have a different outcome depending on ethnicity or poverty, for example. But there are some challenges in accessing the data. So there's not really one complete central record of all of the data. It's a little bit fragmented in terms of being in different hospitals, and it's quite hard to access things like we call unstructured data, so the data that's available in images or scans or in the doctor's notes. So that makes it quite difficult sometimes for companies to get the data that they want to be able to do the product development. It's a little bit easier for researchers. NHS England has set up what we call a trusted research environment for researchers. So and they can get access to some of the data that way. But of course, for commercial use, it's more difficult because there's a kind of reluctance from the population to allow that commercial use.
And so, under this point of view, what could be the three most important steps to create a strategy that allows companies to access this data in the best way possible?
That's a really good question. I think the first one is really including patients in that conversation. So when you talk to patients, actually, if you tell them about the aims, and if it's particularly for improving healthcare, then they're actually quite willing to allow their data to be used, but you have to include the patients in that conversation. Another one is around how you access the data, and there's a lot of work being done at the moment to bring those data sets together and to make them more complete and more joined up. So the NHS is creating something called the Federated Data Platform, which will join up all of the data across England for primary care. And there are also companies that are now requesting specific access. So a company, for example, called Our Future Health, which is creating its own data set, but also asking for access to NHS data for its cohort.
And looking to the future, you out of this interview, we talk about also the impacts of AI in this moment in several industries at 360 level, we can say. But talking about the access of data and maybe also the involvement of patients and also the creation of standards, what could be the next steps? So the next actions to get and to put on the ground in order to go ahead and get success in the data access?
That's another really good question. So, so London, where I'm based, is a real hotspot for AI in health and health innovation. Again, there's a real need to include patients and include patient populations in that collection. But there's also the need, and it's part about reassuring the patients, but the need to make sure that access is secure, that there's no way to access individual records, that patients' privacy is protected. So I think if we can address all of those problems, then there's a real opportunity to make great advances using AI in healthcare.
Thank you for being with us.
Thank you so much.